Welcome back to the Health Longevity Secrets Show with your host, Dr. Robert Lufkin. His book, Lies I Taught in Medical School, is a New York Times bestseller. And now, please enjoy this week's episode.
Have you ever wondered how you can naturally boost your testosterone levels and enhance your overall well-being? Join us this week as we welcome Dr. Jacy Folkers, a seasoned chiropractic and functional medicine expert who shares transformative insights into the vital role of testosterone in men's health. Discover how symptoms like low energy, poor sleep, and depression can signal low testosterone levels. And learn about the impactful lifestyle changes in sleep, nutrition, and stress management that can help you regain balance. Jacey also opens up about his personal journey from managing a brick-and-mortar clinic to co-founding Blokes, a telehealth company focused on men's health and hormone replacement therapy. We explore an array of treatment options for low testosterone, especially when lifestyle modifications fall short. Hear about the importance of tailoring treatments based on symptoms rather than just lab results. And we delve into specific therapies suited to younger age groups and goals. Jacey highlights enclomiphene for younger men prioritizing fertility and discusses the benefits of testosterone replacement therapy for older individuals, including the effectiveness of injections versus creams. We also touch on natural supplements like Tongkat Ali or Ashwagandha for those seeking non-prescription alternatives. Tune in to understand the evolving attitudes towards testosterone and its significance for both men and women, and embrace the potential health benefits discussed in this episode. This episode is sponsored by Cyfox Health. One of the most common questions I get asked is which blood tests I check myself on a regular basis. Well, I check 17 biomarkers, but the secret is I'm able to do everything from the convenience of my home. I collect a sample with just a simple finger stick like this. You don't need to be a doctor to do it. Then I just mail it in and wait for the results. Cyfox Health makes it possible. Use the link below to get 15% off. This episode is brought to you by L-Nutra, maker of the Prolong fasting mimicking diet. If you'd like to try it, use the link in the show notes for 20% off. Osteoporosis is a silent killer, causing 1 in 2 women and 1 in 4 men over age 50 to break a bone. And these fractures can be fatal. Now, the usual way to detect osteoporosis is with something called a DEXA scan, which requires radiation. But if you've already had a CT scan, we can now use that data to test for osteoporosis without the radiation of a DEXA. Check the show notes to find out how and save $50 off. And now, please enjoy this week's episode. Hey, Jacey, thanks for coming on the program.
Thanks a lot, Rob, for having me. I'm super excited.
Yeah, I can't wait to get into hormone replacement therapy and testosterone, and especially the amazing things we're seeing now that some of these therapies are associated with not only living well, but even the possibility of living longer. But
Absolutely.
They're both good. But maybe let's start off. Just tell us a little bit about your background and how you came to be involved in this space.
Yeah, gladly. Yeah. So my original doctorate degree is in chiropractic, and for years I practiced, in the space of functional medicine. And so a lot of patients would come into the clinic and would, bring in their labs. And I noticed a lot of my male patients, would have chronically, just low testosterone, low energy, low libido, and just complain of symptoms like aches and pains and poor sleep and stress and depression. And so at the time, I was really motivated to try to help guys improve their, testosterone through natural ways. Hey, let's improve your sleep. Let's, start eating better and doing these lifestyle, habits to improve testosterone. And as I evolved, I started to really integrate my clinics and hire other practitioners, doctors, and really got into functional medicine at a level where it was incorporating hormone replacement therapy and even regenerative therapies. I was really into helping improve joint health and things like that, peptide therapy. So those are things we can talk about. But then basically, COVID happened, and kind of my practice, my brick and mortar clinic started kind of really dwindling in terms of our patient base, and so was kind of looking for another way to reach people that was COVID proof, or at least or more telehealth proof. And so partnered up with my colleague and the CEO of our company, and we started Blokes almost 3 years ago. And this allowed us to start to basically reach people virtually, no matter where they live. We actually first started just like 5 or 6, like a handful of states. Now we are currently able to reach in all 50 states. So that's like the short version of a long journey. But I'm very passionate about men's health and women's health. Kind of more traditional. As we talked, I'm a girl dad, and I think men, our goal is to provide and protect, and I take that very seriously. And I want guys to really kind of feel energized, feel good and feel vitalized as long as they are alive. And I think part of that is getting labs done, assessing certain markers, especially testosterone, and in helping provide and even recommend tools to help optimize testosterone and other things that can add to their longevity.
Well, great. And before we dive in, I want to emphasize one thing that you mentioned in the beginning that I think applies to so many of the conversations we've had on this program and our overall approach is the drugs, the supplements are useful and in many cases necessary. But before we do that at all, we all need to look at our lives, look at our
Right.
lifestyle, our stress. You mentioned sleep, you mentioned,
Yes.
exercise, these other things. It's like rapamycin is not the cure for,
Right.
you need to get your lifestyle in order too. And it's not a simple pill for any of these chronic diseases or these things. And what, as you said, this applies to testosterone too. So once we get our lifestyle in order, then we can look at these other things. But let's start off. Let's back up. First of all, everyone's heard of testosterone. They've heard different things in the news and with bodybuilders and weightlifters. What exactly is testosterone, and why is it important for us in our bodies?
Right. Yeah. So it's a hormone that in men it's produced by the Leydig cells in the testes of men, and it happens to be a hormone that influences cells in a unique way. In fact, testosterone goes into our cells, and it goes into our cell nucleus, and testosterone actually influences our own genetic expression. So testosterone it really impacts us at the level of the DNA, which is pretty profound, and it also will help us as men, and women, build muscle, maintain muscle. Testosterone will help with enhanced libido. And kind of what you mentioned, pretty much everything that we do that is good for our health, eating better, getting better sleep, managing stress, all these things have been shown to increase testosterone. And the longer we have I call optimal testosterone, it seems like with men, it also translates to a increase in or a decrease in chronic conditions over the time. In fact, a lot of chronic conditions that men suffer from, heart disease, cancers, actually correlate with a declining testosterone. So this is a hormone that is very important. It actually kind of peaks when we hit puberty as young men, and that's when you see young men get more muscular and grow, and voice deepens, and so it is responsible for those things as well. But it really does help contribute to what I feel makes men feel like men, to be fathers, to be good leaders, good husbands. And when testosterone drops, I'll ask questions like, what's your libido like? What's your ability to build muscle like compared to, 10, 15 years ago? What's your sleep quality like? And oftentimes when testosterone declines, all of those things also seem to be on the decline.
Yeah. So, and just to be clear, testosterone, as you mentioned, is one of those naturally occurring hormones that with aging actually gets lower.
Yes.
Unlike some markers like hemoglobin A1C actually gets higher with aging,
Yes.
and
Right.
some of the bad things increase.
Right.
Testosterone, the problem, the challenge with testosterone that we face with aging is too little of it. So
Right.
what we're going to be talking about is how we supplement it, what is optimal. You mentioned a few signs,
Right.
just things that will indicate that. What are the, what's the gold standard, blood test, or what, if I experience these things, then
Yeah.
what's the next step in finding out if testosterone is the issue?
Yeah, great question. So, and you actually, I'll answer another question you made me think of. So, yeah, you want to look at blood tests. You want to look at markers like total testosterone. Um, I also like to look at sex hormone binding globulin, albumin, estradiol. I mean, I also like to look at the hemoglobin A1C, fasting glucose, because guess what? As testosterone drops, as a man starts experiencing lower testosterone, it actually contributes to more insulin resistance. In fact, when we improve a man's testosterone, meaning help it go increase and get more optimized, we oftentimes will see an improvement in hemoglobin A1C. That will actually drop. So, but a great place to start is have a lab test done that looks at total testosterone, estradiol, sex hormone binding globulin, albumin, because then you can actually calculate what the free testosterone is as well. And there's a difference between total testosterone. That's like how much testosterone is in the blood. I like to really hone in and pay attention to what the free testosterone is, because it's the free testosterone that is what's bioavailable. That's what the cells can actually utilize. And a lot I've seen in cases where a man can have optimal total testosterone, but still have suboptimal free testosterone based on other markers in the body, like a high sex hormone binding globulin and or even a high estradiol or things like that.
Is there obviously it's very complex, the hormone system and all the stimulation and the way it's bound to albumin and what's available, what's
Correct.
bioavailable is.
Yeah.
Are there any numbers or cutoffs that people could think of what is optimal, and is optimal the same as normal when they get the labs
Such
back? Is that the same? It's not in a lot of things we're
a
finding out, but how about
such a
with
good
this
question.
this thing?
Yeah, such a great question. No, so when patients go to most clinics, hospitals, what have you, they'll get a lab check done. And to your point, like normal essentially is, when we're being compared to like other essentially unhealthy individuals, and they create this kind of like normal or standard range. And so that is different from optimal. So like the normal standard range for like testosterone, I mean, it's a huge range. It's like it varies from what lab, but it could be anywhere from like 250 to like 980 or something like that. I like to see men in optimal testosterone 700 to 1100, and this is after looking at thousands of labs. And these are where guys actually feel, yes, I feel my libido is improved, my energy's improved, my focus, I have less brain fog, I'm sleeping better, I'm building muscle. Usually we don't see these things when a guy's living at around 300. So
Hmm.
there's definitely a difference between optimal and normal.
And so then so someone experiences these symptoms, or then they get these tests done, this panel of blood tests, and it's interpreted we want to look at optimal, not just what the normal says on the sheet that you get
Correct.
back from the lab, because it's frequently we don't want to be normal. We don't want to be like a
Right.
normal 40 year
Right.
old or a normal
Correct.
70-year-old or
Right.
whatever.
Right.
We want to be optimal for that, and that could be very different. So now it's possible if we've identified we've identified a symptom that we
Yep.
a set of symptoms. We get the blood tests that we're low in this. Then we look at our lifestyle and we go through the checklist. We look at our sleep, our diet, our, all the things that we can change. We've optimized all those, and we repeat the lab test, let's say, we still have this suboptimal level of testosterone. What are the options there? What could people consider at that point?
Yeah, great question. So definitely, um, like you alluded to, like really listening to the patient. Are you still experiencing these symptoms like low energy, low libido? Because we can't always go off the numbers on the paper. We don't want to just treat the labs, but really treat the patient. And if they're still experiencing these things, they're still obviously suboptimal. Um, I'll we got to find out, okay, what's this man's goals, and what's his age, and where is he at in his life? If he's younger, and if fertility, for example, is still important to this guy, and if also just um where he where he is at as far as exercise and his goals in life, we can offer something called enclomiphene. And enclomiphene is a medication that is very effective for stimulating the body's own testosterone production. And this is very effective for guys, like I said, that are really still prioritizing fertility and maybe want to have children and those kinds of things. And we've seen really great and significant increases in testosterone with enclomiphene. And this is basically relying on a man's ability to still make his testosterone. Um, Now, if a guy is maybe older and he's in his like late 50s, 60s, 70s, and like my dad's 75, and he's on TRT, so he's actually on testosterone replacement therapy, and that has been very effective for him to keep his testosterone levels in that optimal range, help him feel better. In fact, his friends and that he hangs out with around his age are impressed with how he looks and how he feels and what is he doing, and asking him questions. And so he's referring a lot of his buddies over to us. And so, but yeah, um, there are options. Testosterone replacement therapy has its place. There's also clomiphene, enclomiphene, or by the way, and not to get too complicated, but clomiphene is kind of similar to enclomiphene. Enclomiphene is actually an isomer of clomiphene, and clomiphene's been around since like the 1960s. It's FDA approved for fertility for women, but it's used off-label for men to once again boost testosterone production and even enhance fertility in men. So, and then there are also certain peptides and supplements that we often can recommend if a guy's like, yeah, I don't really want to. I want to try something more natural. I want to try something a little more that's not a prescription. So we've even formulated some products that have things like Tongkat Ali, fenugreek, DHEA, some other things that kind of have been shown, ashwagandha, uh, have been shown to help increase testosterone. So there is a more supplement kind of way option there. Then you have the prescribable enclomiphene as well as testosterone.
And so if they want to maintain fertility at a young age, they have the one option with the enclomiphene. And then
Yes.
at a later age, they can either go with testosterone replacement therapy, or they may want to try these alternative peptides that you mentioned
Yep.
as well. Now, for the testosterone therapy, what does that look like? Is that a shot? Is it a pill? What will the patient experience?
Yeah. Yeah. The most common way, I get deliveries of testosterone injections are pretty common. Some guys do experience some degree of success with the creams. So the two most common ways that we recommend are injections or creams. The injections are pretty effective, especially when you dose the man appropriately. We often start low with our dosing, move relatively slow. We want to monitor and check labs with our patients. We actually like to recommend at least a split dosing protocol, which is injecting twice a week.
Mm.
More older therapies are that have been around for a while, like once a week was like the standard for time. However, when you're injecting a larger dose of testosterone, we start to see an increase in higher estradiol numbers and hematocrit hemoglobin numbers. So we found when we cut that dose in half and do it twice a week, sometimes even 3 times a week, you're administering a lower dose. And so we see not so much of a of the aromatization, not so much of a giant bump in estradiol, as well as hematocrit and hemoglobin numbers stay a little bit in a better range as well.
And just to be clear, these injections, the person can do them themselves.
Yeah,
They're fairly easy to be trained. So it's not like they have to go into the doctor's office twice a
correct.
week to get it done. So it's an at-home thing, right?
Yeah, in fact, we most of our patients are able to inject subcutaneously. So we will send the syringes, alcohol wipes to our patients along with the testosterone. We send videos and instructionals how to draw it up and how to inject themselves. It's once they do it like 1 or 2 times, it's like, wow, this is pretty easy. So it's fairly non-invasive and, to your point, very easy to do on your own.
And how about contraindications for this? We've heard about you hear about prostate cancer. Is that a contraindication? Are there other things like that? What
Yeah.
would people have to worry about, or who would be excluded from this?
Yeah, that's why we do test like PSA markers, and we do take a history of our patients. If there is a history of recent prostate cancer, we often won't start them on therapy unless they get clearance from their doctor, from their oncologist. If a patient has really high blood pressure or some sort of cardiovascular risk, once again we won't treat them until they get clearance from their doctor. So we work with patients, physicians to make sure that that they're a really good candidate because honestly, like you said, at the end of the day, there really is no such thing as a magic pill. I mean, testosterone is great when it's optimal, but we want to make sure that that person is healthy. And so once again, addressing those lifestyle components, make sure that they're eating right, making sure they're healthy individuals, because we don't want to throw something in that could cause an issue.
Yeah. And so yeah, those things we have to be aware of. And then any side effects that people should watch out for as they're taking this. You hear stories with bodybuilders of,
Right.
anabolic steroid rage and anger, but we're not dealing with those kind of doses, I don't think, are we? Or
No, you're kind of referring to like the typical kind of guy that like at the gym that's, obviously taking like a more of a super physiologic amount of of testosterone, and that's where a lot of the stigma comes from, I think, is the overly dosed guy that then his estradiol, his estrogen levels go through the roof. So he's taking, aromatase inhibitors and things like that. And if you dose a man appropriately, uh, which that's why I'm a fan of the frequent split dosing, or even sometimes 3 times a week dosing. We don't see a need for aromatase inhibitors like anastrozole, or a need to like really block estradiol, which happens to be a very beneficial metabolite of estrogen, or of testosterone rather. But yeah, to your point, it's when you dose the man appropriately versus giving him these gigantic, super physiologic dosages, you can really enhance the man's life versus, having all these side effects that I think a lot of those things, most of our patients don't experience really anything but improved mood, but improved mental health, and more. I have patients that are actors, and they say they can memorize their lines better. They almost like they have less brain fog, better sleep quality, better libido. So it helps the relationships, and once again helps with building muscle and just feeling better.
Hmm. Yeah, tell me about your company. I understand this is available to people all over you all over the United States. It's a telemedicine company. So yeah, talk about
Yeah.
what is the
Yeah.
patient experience there?
Yeah, we try to make it very convenient, very easy. So a patient can go to their smartphone or their computer and go to Blokes, Blokes.co. So our company, the men's side is called Blokes. We actually have a woman's side. It's called Choose Joy, spelled JOI. But you can go to our website, Blokes.co. It allows patients to go and order a lab right there, and then they can go to their local LabCorp or Quest and get their lab draw done, and then they'll be able to schedule with one of our providers to go over their labs, look at their hormones, and decide if they are a good candidate for one of the therapies to optimize their testosterone.
And yeah, and with your company also, the provider would be a physician also, so that they would get a prescription for this, and all of that would be taken care of as far as that side. Obviously, they can interface
Yep.
with their local doc and let them know what's going on. But as far as managing the testosterone and everything, your company would provide that through a
Correct.
telemedicine portal and all. That's yeah. What are the biggest questions people ask you about when they come to you? What are the biggest questions they ask you about testosterone?
Yeah. Yeah, I think one of the most common the guys ask is, hey, so if I start one of these therapies, do I have to stay on it forever? Now with testosterone, the answer is it's kind of interesting, because if a guy comes in, let's say his testosterone level is like 300, and he gets on testosterone, and in that therapy gets him to like 900. Typically, yes, a lot of times when guys get on TRT, they start to feel better. They start to change their lifestyle. So it can be that catalyst that helps them do the things that can, in fact, help increase their own testosterone production. But oftentimes, when a guy decides to, for whatever reason, discontinue taking testosterone, his levels don't stay at the level that they were on the therapy. Okay, so they typically will go back to maybe where they were, or a little bit higher, depending on what lifestyle factors that they've implemented. With enclomiphene, we've seen interesting differences. With enclomiphene, because it's stimulating a man's testosterone production, we oftentimes don't see a significant decline in their levels if they discontinue after like 6 months or a year of being on enclomiphene. It just seems like the mechanism of action is so different. But once again, all these things I feel like are significantly influenced by the lifestyle factors that they embark on when they start to feel better. And and really, I encourage guys to take advantage of those benefits of having elevated testosterone. But that's probably the most common question, I guess. Do I have to do this forever? Not necessarily, but it's like you want to kind of, if you're feeling better and if it's improving your health and maybe adding years to your life, I feel like let's do it as long as possible.
Yeah, yeah, it's almost a virtuous cycle. If
Yeah,
they feel better, then they
yeah,
take charge of their lifestyle and make better choices in their exercise and stress
yes,
and sleep, and then it all builds on itself. That's really
yeah,
that's exciting. It's well, this has been great. I maybe I how can people, you mentioned the website there, how can people follow you on social media and find out
yeah,
more of the work you're doing,
yeah.
JC? Yeah.
Yeah, absolutely. Yeah, so we have a couple different, like our company. We have a Instagram. It's at Get Blokes. Get Blokes is spelled Blokes. I have an Instagram. It's DrJacey, Dr. Jacy, on Instagram. So those are two ways you can follow us and find us. And yeah, and we're happy to educate, and that's our goal, is help guys feel their best.
Yeah, there's certainly a real changing attitude about testosterone. Many more men are aware of it, and doesn't have the stigma attached to it. And a lot of misinformation has been cleared away. So it's
Right.
important people understand the possibilities of improving their health with some of these things.
Yeah, absolutely. I mean, it's like, and testosterone, like we always talk about how important it is, obviously for men, and it's equally as important for women. And it's a human hormone that we should, all, embrace. Because once again, like it seems like a lot of the things that we do that improve our health seem to, there's a correlation. We see testosterone goes up. So it kind of, there's like a relationship there. So it definitely lends itself to improving health for sure.
Yeah, well, thanks again, JC, for spending 30 minutes with
Yeah.
us today, and thanks so much for all the great work you're doing.
Thank you so much for having me, Rob. It's been a pleasure.
If you are enjoying this program, please hit that subscribe button, or even better, leave a review. Your support makes it possible for us to create the quality programming that we're continually striving for.
Can I start? Is it recording?
It's already recording.
Oh, sorry. This is for general information and educational purposes only, and it's not intended to constitute or substitute for medical advice or counseling, the practice of medicine, or the provision of healthcare, diagnosis, or treatment, or the creation of a physician-patient or clinical relationship. The use of this information is at their own user's risk. If you find this to be on the value, please hit that like button to subscribe to support the work that we do on this channel. And we take your suggestions and advice very seriously, so please let us know what you'd like to see on this channel. Thanks for watching, and we hope to see you next time. You should say that.
No, that's good. That's pretty easy. I think that's pretty good. You like it? You want to do it one more time, or is that good? I think that was good.
Yes.
All right.
You need to save the recording.
Very good.